And now to share insights and celebrate your achievements, I am honored to introduce our graduation speaker, Ms. Laura Colbert. Laura is the Executive Director of Georgians for a Healthy Future, a nonpartisan health advocacy and policy organization. She has worked at Georgians for a Healthy Future since 2014 and stepped into its leadership position in 2017. Laura previously worked at the Children's Healthcare of Athens, HSTAT, a student-run health policy and advocacy organization, and the CDC's Division of HIV/AIDS Prevention. Laura sits on the advisory committees for Georgia's Departments of Community Health and Public Health, New Disabled South, and the Georgia State University Center for Leadership and Disability. She serves as a consumer liaison representative to the National Association of Insurance Commissioners and previously served as a board member to the Georgia Society for Public Health Education. She earned her MPH from Emory University, where she focused on health literacy and the social determinants of health. Previously, Laura attended the University of Georgia, where she studied biomechanics and her BS in education degree, and she is has a Master of Certified Health Education Specialist. So please join me in a true UGA welcome to Ms. Colbert.
Thank you, and congratulations to the College of Public Health's 2024 graduating class. Today is your day. Congratulations. You have done it. You've taken your last exams. You have finished your last group projects, hopefully, and you are smooth sailing out the door. I do hate to break it to you, most of your public health career will be group projects, so that one's going to come back around for you. But hopefully you've gotten enough practice while you've been here at UGA. I'm really honored to be here with all of you this afternoon, with you graduates, with all of your loved ones, and with the UGA College of Public Health faculty. Thank you so much for having me on your celebratory day. And again, just kudos on all of the hard work and commitment that has brought you to this afternoon. When Dean Davis invited me to give this afternoon's address, I have to say I felt phenomenally underqualified, and I still do, standing here in front of all of you this afternoon. This is the first commencement address I've given, and so I asked for Dr. Davis's advice. And she said you all would appreciate knowing just how much you are needed in public health and that you will do good work with your careers. And she asked that I reassure your parents. Parents, they're going to be fine. They're going to do great stuff. And I thought the dean's advice was really excellent. First, because everybody really enjoys hearing that they are going to do good work and make an impact on the world. And second, because it is absolutely true in this case. You are needed in public health, and you will do important work. I know that's the case because I've spent a decade and a half in public health, as you heard from my bio, which is always too long when I hear it. I am a public health educator and advocate. I was trained in public health education. A special shout out to the health promotion folks in the room. And for the past 7 years, I've led Georgians for a Healthy Future. You heard that we are a health policy and advocacy organization. And so what that means for us is that we work in nonpartisan ways to shape and change Georgia's laws, systems, and policies so that every Georgian has a fair shot at living a healthy, thriving life, regardless of who they are, where they come from, or how little money they make. I spend a lot of my days collaborating and strategizing and traveling around the state with government public health workers, with rural and safety net healthcare providers, with other advocates, and some days with our state's elected leaders, and every day with Georgians from all walks of life who care about the health and well-being of our state. Together and in different combinations of those groups of people, we have won some really awesome public health victories in my time. We helped pass a new state law requiring that health insurance cover mental health and addiction recovery in the same way they cover other health services. Very important. We've extended Medicaid coverage from 60 days to 12 months after a new mom gives birth so that she and her baby can get that postpartum care that they need. We've expanded access to care for HIV prevention medications for adults and free dental services for kids in schools, all really important health services that we know folks across the state and across our country really need. There are some really big battles and big victories that we have won, and there are many ahead that we haven't yet been successful with. But I know we will, and hopefully with your help. Across each of the unsuccessful and successful efforts that I've been a part of, I've learned that the best and most effective, most important public health work involves 3 key components, and that's people, power, and possibility. I realize saying that people are a key component of public health seems really simple and obvious. People are required to do public health, and public health is all about people's health, right? It is simple, but in a lot of days and in a lot of ways it can be really difficult, especially the longer you're in the field. 2 years ago, my organization was beginning research around healthy housing and especially barriers and challenges to healthy housing for people with intellectual and developmental disabilities. We had just wrapped up a different project with that same group of folks here in Georgia around healthcare coverage. And it wasn't as successful as we would have liked. You know, it went fine, but it was not, it didn't get exactly the results that we were aiming for. And so we knew we needed to learn some lessons from that and go back to the drawing board. And one of the lessons that we took was that we needed to take more seriously the disability advocacy slogan, "Nothing about us without us." And so this time, we knew we needed to bring along those Georgians with intellectual and developmental disabilities in a project that was about their housing and their health. And so this time, we took the time to establish a leadership advisory committee. We recruited members. We helped them become familiar with the project and our research goals. And we got their input on the survey tool that we were developing so that we could find out more about the challenges and experiences they were having with housing. And this time, the time and investment paid off. We sent out that survey and the leadership team went to work. They got that survey to every corner of the state. We were hoping for 400 responses and we got 1,600 valid responses from 117 counties across the state with an overrepresentation in rural areas. And I know for the public health nerds in the room, that's super exciting. And for the families, you guys are like, what? But we couldn't have asked for better results is essentially the bottom line. And that research and the relationships that we formed with those leadership advisory committees form the foundation today for our healthy housing advocacy and policy work. And they will for years to come. They really gave us the gift of their time, their resources, their networks, and their lived experiences. You all in your careers will have experiences like this too. You may forget to involve people the first time around and you'll struggle and things won't go the way you exactly want. And then you'll remember, you'll come back to what you've learned here at University of Georgia and you'll remember to include people and to build and strengthen the relationships with the people that you are doing health with and for. And then you'll find success. Public health is about people and it's also about power and possibility. As a public health advocate, a meaningful part of my job is imagining and helping other people imagine a state and a world different from the one we currently live in. A state where no one is ever turned away from healthcare because they can't afford it. A state where every school has a school nurse, yes, to take care of scraped knees, but also to take care of kids who are navigating mental health struggles. A state where we've eradicated HIV or gun violence. You probably chose public health because you imagine better, healthier possibilities for the community or the country that is close to your heart. You all are young and bright, as demonstrated by just being here this afternoon, having earned this degree. And your possibilities are likely a lot more imaginative than the ones I've listed today. We need those that youthful energy, those ideas, and those new possibilities in public health. We really do. Once we imagine those possibilities, my next step in my job is to bring together the resources and strategies that it takes to reshape systems of power and money so that we can make those new possibilities real. And I would contend today that that is also your job. Even if your job title after today does not include the word advocate, that is part of public health. In 2019, a coworker and I drove down from Atlanta down to Glenwood, Georgia. Glenwood is in Wheeler County. It's got about 850 residents. Any Wheeler County folks in the room today? I didn't think so. It's a small place. We were there to hold a community conversation with people living and working in the area about the impacts of their hospital closing. And the community conversation had gone well. My coworker and I were headed back to our car, and we ran into two men on kind of the little downtown strip. Both of them kind of middle-aged, white, primarily working in agriculture. We found through the conversation that we had, and they could immediately tell we were not from Wheeler County. It was very obvious that we were from Atlanta, and kind of asked why we were visiting. And we told them, we shared that we were interested in learning from folks living and working in Glenwood to help prevent other hospital closures through different law and policy changes. And I've found that in these conversations, when we talk about policy change, people quickly make the connection between policy change and voting, and these gentlemen were no different. And one of them said, I think our votes should count more than people in Atlanta's. They're getting more while we're getting less. And when I think back on this conversation, I don't think that this man actually thought his vote should count more than mine or more than yours. But what he was expressing is what he saw as a lack of power because his community wasn't getting what it needed. And they weren't. The Glenwood Hospital had closed in 2014. After the hospital closed, so did the bank and the grocery and the pharmacy. They still don't have a grocery in the entire county. They're downtown, which is it's 2 blocks long, right along the railroad tracks, like a lot of our small rural towns here in Georgia. It went from a lively little strip to essentially empty in the course of a few years. They weren't getting what they needed because they didn't have enough money or the right influence. Because they didn't have a lot of money, they also didn't have health insurance, which means that it was hard for their hospital to get paid when it provided health care. That meant it was hard to pay their staff and their other bills. When the hospital closed, businesses in the downtown couldn't stay open without the traffic from hospital workers and their families and the patients. The tragedy of all of this is that there were solutions for Glenwood. If state leaders had expanded Medicaid when the Affordable Care Act was passed, many more farmers, workers, and parents would have had health insurance, and the hospital may have survived. At that point, it likely would have been by the skin of its teeth, but for folks in Glenwood, it would have mattered a lot to have that hospital open for a year or another couple of years. So much of our world, including whether your local hospital stays open, is shaped by these often invisible power structures and by the ways that money flows through our economy and our health systems. These structures can be twisted and bent by systemic racism, ableism, sexism, and other forces that I hope you've become familiar with during your time here at UGA. And if you haven't, I would encourage you to reach out and find a mentor or reading to really understand that, because you will certainly bump up against it throughout your public health careers. Because you are graduating today, either with your first, second, or even third degrees, you will hold some level of power. Less than a third of the state of Georgia, of residents in the state of Georgia, have a college degree. And as a result of having your college degree, you will have access to resources, decisions, and power that many of our family, friends, and neighbors will not. I often sit in rooms with elected officials that my next door neighbors will never meet. You will unfairly have more power than they do, and when we are doing our best public health work, you will find ways to redistribute that power so that it's slightly less unfair and it gets us to the possibilities that we imagine for our communities that you all came in hoping and wishing for, and that you will leave today working towards. That can look a lot of different ways. In my world, that looks like advocating for new laws or really wonky regulations down at state agencies. But for you, it could mean training community members to collect and understand their own data to tell their story about their health outcomes. It could be training teens and young adults who are in recovery to be peer mentors and counselors for others who are trying to get to recovery. It could be helping train trans and non-binary Georgians, helping trans and non-binary Georgians anonymously share their stories of discrimination in healthcare so that you can change the practices and attitudes in the hospital or insurance company you work for. There are a lot of ways to redistribute and reshape power. At its best, public health reshapes these unfair and inequitable power structures in order to realize new possibilities. That is our job. We get to work with people to build power and to make the impossible newly possible. It's a really magical sector to work in. After today, you will enter the world, likely a working world, where it is really easy to get lost in the day-to-day, where daily habits and inertia really grab a hold of your to-do list instead of kind of that innovation and brainstorming and excitement that you all get a lot of when you're here in school. It will be really easy to simply go through the motions and pretend like you are doing public health rather than really doing it. Skipping the community input part of the project because you're up against a deadline, ignoring the power structures that determine the outcomes that you are trying to address because policy change is too hard, or becoming cynical that change is even possible. But I have faith in you. I think you will do more than just pretend. You will do the good public health work by applying the skills and expertise that you've learned here at the College of Public Health. And second, by doing it with and alongside people working to rebalance power and so that the possibility of a healthier, more equitable future becomes reality. I believe that about all of you, maybe except for the ones who are in health management. I don't know about you guys, but who's inspired to be an administrator? I don't know. I'm obviously joking. You will all do incredible work regardless of where you're at work. This year marks my 14th year working in public health, and I can honestly say there is truly no better work to do each and every day. And after today, you all are joining me in this work. What awesome opportunities you have in front of you. Congratulations to you for all the hard work that brought you here today. Kudos and best of luck. Congratulations to the 2024 class of the University of Georgia's College of Public Health.